Before I can talk about the new face of spider veins, you need to know about the old face of spider veins. In other words, how has this come about? Why are we looking at something new? Now, for years, the old treatment of spider veins on the legs was always with injections, and still is, works very well. And the various machines came along onto the market to deal with those veins. In 1999, I got the first CE for a machine called VeinWave. Now, I've been doing veins for a long time. I started medicine in 1968 and started doing veins in 1973. So I've seen lots of things come and go. And it's very interesting that the old machines, the old 4 megahertz machines, which are known as VeinGo, Thermovein, VeinWave, and Viridex RF, and I think there's probably a few more, are still here. In fact, not only are they still here, still being used, they're still in the same boxes. They look exactly the same, but they work. But as time goes on, things work better. Now, one of the problems that we see, particularly with injections, and those of you that do injections on the legs, and you shouldn't really be doing injections for thread veins on faces, on legs, you get redness, you can get matting, you can get discoloration, and sadly, if you inject outside the vein, you can get ulceration. Now, with VeinWave and Thermovein, TC3000, and the other 4 megahertz units, there is unfortunately the risk of pitting, scarring, and skin discoloration. The downtime for these treatments also is quite considerable. So the treatment itself is quite painful, particularly around the nose. So 4 megahertz around your nose will make your mascara run. So the mascara test is very important. And with the new treatments, there's virtually no pain. One of the problems, of course, of using local anesthetics when you're doing small veins is it makes the veins contract, so you can't see them properly. So it's nice if you can have the vein dilated. Now, the other thing about the downtime is that after facial treatments with 4 megahertz, you can get considerable redness. It can last up to 5 days on the face. It doesn't stop you doing things, but it's unnecessary if you can have a treatment that doesn't do that. And on the legs, the treatment time can take anything up to 6 weeks for things to settle down. And then you may need 4 or 5 sessions of treatment. Most treatments on the legs with 4 megahertz technology require top-up with injections or larger needles to treat. In America, the machines, the 4 megahertz machines, are 510K approved as epilators, and as for the treatment of veins only on the legs up to 0.3 of a millimeter. They're not licensed for treatment on the face, although doctors can use them for whatever they want. Now, one of the things you have to be very, very careful of when you see a demonstration is somebody saying, this is a wow factor. Well, seeing what happens in a demonstration and what happens 3 months later to a vein are two different things. So seeing isn't always believing. So what have we got different with this machine over here? Well, first of all, it's 27.12 megahertz. That means 27 million oscillations. Very, very quick. And we're going to talk about the 5 Fs, and Carol's going to demonstrate these now. The first one is the frequency. The second one is the new filament that we use. The next one is there's no foot pedal. Then it's fast, and we have the flash setting. So the reason we have 27 megahertz is it's incredibly quick, and because it's so fast, it's virtually painless. Now, the needle itself is minute. I'm going to pass a couple of these round to you to have a look at. If you take the needle out, there's 3 sizes, K3, K2, K6. The Bali needles that we use for 4 megahertz technology are either nickel or gold. Carol, do you want to start doing this lady's nose? Are nickel or gold. Our needle here is stainless steel, and it's covered in Teflon. It's a micro guard. You cannot get any burning, you can't get any discoloration, and there have been no cases reported of any scarring. Now, obviously with some of the older technologies, it's been around a long time, so it's possible that scarring could occur over years of a lot of use. But so far, and this is used widely in Europe, in South America, in the States, it's not caused any problems at all. And in Canada, where it was originally made. So you can see this lady having the treatment on her nose. I'm just going to ask her if it hurts. Is it hurting? Did you hear what she said? Can you just speak up?
Not at all.
Her words are not at all. And that's very, very important. Absolutely no pain. And I haven't paid her to say that either. So it's very, very important. The distinguishing feature between this rapid pulse and the old-fashioned pulse that we have in the older machines. Now you should be able to see a picture if we can get a bit closer. Can you get a bit closer with your camera onto her nose to see the vein disappearing? Carol, can you swing her nose round so we can see? Thanks. And you can see where the vein was and where the vein's been taken away. There's no tissue damage at all with this technique and with this needle, unlike any other treatments that are currently available. And you can see Carol now working around the top of the nose. There's no bleeding, no smoke, no smell of burning. So it's completely different to the normal electrolysis treatment at 13 megahertz, where you're forever cleaning the needle off and you can smell the burning. This is totally different. Okay, so just tell us what it was like.
I really couldn't feel anything. I was quite nervous having it done. I don't do needles very well, and no, it really was painless. Really was.
Thank you very much. So that's a very, very important point. No pain. So, got another person now, gentleman.
I just need to confirm the treatment that the patient just had was just the telangiectasia of the nose.
Yes.
Is that right?
Yes.
Yeah. Okay.
And this gentleman, now he's got rosacea on his nose, and if I get out of the way here, if we can get a picture of his, get a picture of his right cheek. So you see his right cheek, he's got some nice big veins there. Now on his nose, I've already had a word with him that because he's got rosacea, we would have to treat the rosacea before you treated the veins. Now it's very, very important this. It's pointless thinking that any treatment you do for veins will make the veins go away. You always have to treat the underlying cause. And the underlying causes on faces and the underlying causes on legs are completely different. On legs, venous hypertension has to be treated. So when you see thread veins that are proud from the skin, you know they've got high pressure, and the pressure feeding vessels need to be treated. So it doesn't matter how good your lighting system is to see it, you can see as much as you want, but if you don't treat the cause, they'll always come back again. So although you might see the vein go away to start with, it doesn't mean it's gone 3 months down the line. Now this gentleman, I've already said, we will treat his cheek because there's little in the way of rosacea. We'll let you see some veins go on his nose, but those veins without pre-treatment would recur. So it's very, very important. Now we have a training academy at Natura, and we train specifically in the diagnosis and management of aesthetic cosmetic veins. And in all the years that I've been doing surgery, one of the most humbling things is the management of spider veins. They are extremely difficult. So we're just going to treat your face now, okay? Yeah. Just, can he borrow?
The spider veins on the legs, blue and red, they are disappearing in the same way?
No. Veins that are red, up to 0.3 of a millimeter, you can clear. Veins that are blue, up to 0.3 of a millimeter, you can clear. Veins greater than that, I would inject. And I would use either polydocanol, which I think gives you the best results, gives you the least in the, problems with discoloration, scarring and matting. Now, when Carol takes her hand away,
and you can use it all over the face, can't you?
You can use
the
this
hands,
anywhere on the body.
Yeah.
Now, we're only talking about spider veins. It has got other uses. And if you visit the stand, I'm sure they'll give you the brochures of all the different things that you can use this for. But my specialty is veins. I want to concentrate on veins, and I want you to see veins as they should be treated today. Now, I'm just going to ask this gentleman whether this is hurting. Is this hurting? Okay. He's just said, in a really broad American accent, not at all. That's really very important. So this is a fundamental thing, to have a completely painless vein treatment. So in my summary, what I would say is that treating veins is almost like the history of the motor car with machines. The cars that in a few weeks' time will go from London to Brighton are old and still get there. But there's a better way of getting there now.
Terrific.
Thank you.
Brian Newman, thank you very much.